So, good morning everyone. So, in this video, we're going to talk about the Judy's case study, including the summarize, the description of the patient, and also the discussion and conclusion of the case study. So, to give you a summarize about the case of Judy, si Judy ay isang babae na nagpe-faint or nahihimatay tuwing nakakakita siya ng blood. Siya ay na-diagnose na tinatawag nating blood injury injection phobia. Ang blood injury injection phobia, it is a type of condition characterized by avoidance behavior or intense irrational fear to seeing blood, injury, and injection. So, the details of Judy's case study. Patient's description. Judy is a 16 years old girl student who experienced fainted at the sight of blood and diagnosed with the blood injury injection phobia. Case history. About 2 years, Judy's first class in biology, her professor showed about a graphic film that representing the frog dissection to illustrate the various points of the anatomy and also shows that image of blood, tissue, and muscle that trigger her phobia. She felt lightheaded and avoiding any situation that might be in seeing blood and injury and injection. So the physical examination result. Her family can't find out what's wrong with her. Even several other physicians, but the time she was referred, she was fainted about 5 to 10 times a week. That clearly it is a disturbance and disruptive to her. So the result of pathological result tests and other investigation. A psychological disorder characterized by marked and persistent fear of an object or situation. For people who react as severely as Judy, this phobia can be disabling. They may avoid certain careers such as medicine or nursing, and if they are so afraid of needles and injection that they avoid them even when they need them, they put their health at risk. So the treatment plan. The fear of blood and injury or injection is so intense that you find yourself avoiding doctor's appointment, routine tests, or vaccine. Talk to your doctor or seek treatment by a certified mental health care providers. A common treatment for BII phobia is applied tension or AT. A technique to help BII phobia individual preventing fainting or recover more quickly if they faint. AT involves tensing your muscle which raises your blood pressure, making you less likely to faint. So the separate outcome of the treatment plan. The typical treatment for BII phobia involves teaching the client how to avoid fainting. The staging multiple gradual exposure trial for the client. By the end of the trial, she was able to give blood for a medical test and to donate blood for the first time in her life and work as a volunteer at the blood donation center. The result provide the first evidence that the adult with BII phobia can end the phobia by arranging their own session of applied tension practice and gradual self-exposure. So now let's proceed with the discussion. The following are the discussion of Judy's case. So including the what is phobia and the sign and symptoms. What is phobia? Phobia is a type of an anxiety disorder which is characterized by irrational fear and anxiety in relation to certain objects or situations. The most common category of specific phobia is similar, including the animal phobias, natural phobias, blood injection injury phobias, and situational phobias. So the sign and symptoms. So number one is the significant fear about the specific object or situation. Number two, the significant anxiety about a specific object or situation. And the number three, near or painting upon encountering object or situation. And the number one, elevated heart rate and or blood pressure upon encountering object or situation. And then the last one is active avoidance of the particular object or situation. So the last so the last part is conclusion. The conclusion is phobias can significantly impact our lives, including our performance, productivity, and overall well-being in the workplace. However, effective treatment options such as exposure therapy can help individuals overcome their phobias and regain control of their professional lives. So, in addition, or in my opinion, ang phobia po ay naaagapan. Pwede siyang maaring sa mga exposure natin or nilalabanan natin by doing the experience and also yung hinaharap natin yung mga takot natin sa buhay. And that's all. Thank you for watching.